Many thanks for your time here on News Desk this morning. Let's start off with that particular issue on the health front. And Denmark will stop supporting Ghana's health sector at the end of this year. It brings to a close a relationship which spanned a total of 22 years and donor support with hundreds of millions of dollars. The Danish ambassador to Ghana, Tove Dengbo, explains that withdrawal of support will create a funding gap which could cripple the National Health Insurance Scheme, and is calling on government to take steps to mitigate the impact. She was speaking on the sidelines of a program to mark the end of the era.
Denmark, through its development agency Danida, has since the mid-90s supported health sector in Ghana, increasing its assistance over the years. It has, among others, advocated for a strong pro-poor focus on health and advocated for primary health care interventions aimed at the poorest Ghanaians in the most remote areas and with the highest mortality rates. Denmark has says its decision to scale down its aid program to Ghana is to enable it to focus more on countries that are in dire need of donor support. It follows Ghana's attainment of middle income status. According to the Danish government, since the first health sector support program, the assistance has gradually moved from a project approach to sector-wide approach and sector budget support. The last fifth phase, signed in 2012, saw Ghana receiving $70 million over 5 years, with the last tranche coming through this year.
We are now contributing with the strengthening of the tax system in Ghana. There are a number of challenges with the national health system. That's the insurance system. There's no doubt about that. I have been myself out in Kumasi in rural areas, spoken to district staff, and I'm absolutely convinced that there are a lot of challenges to work on. I also see the willingness of the Ministry of Health to address these issues. The ongoing study of the National Health Insurance is a very good tool to identify the challenges. Danida is actually contributing to some of these studies also, because we find it so important that the issues are addressed and rectified. I mentioned in my speech the example of women who go to clinics, and they should be allowed to go there free of charge because they have paid for their NHIS, and then they are turned away or asked to pay additional fees. This is not how the system should be. And it's so important to address these challenges and make sure that poor people in remote rural areas, they actually do have the right to health services.
Health Minister Alex Segbefi admits Ghanaians will probably have to pay more taxes in the future to ensure sustainable funding of the health sector.
As a country, we have to begin to, one, educate our people of the situation, but also begin to plan our budgets and our economies to realize that our responsibilities are now greater. And we must also learn to deal with wastage and deal with issues that lead to wastage, so that the little that we are generating can be used to, one, maintain, and then secondly, develop what we already have to take us into a better place that we all want to be. We can't let a gap or a void be created. I think that there has always been a good plan. Danida has helped to lay the foundations. We have built as a government a basis to continue what is there already. So I don't actually even see us as stagnating even when that help goes. I see us actually moving from strength to strength.
The Danish government will completely phase out its financial support to other sectors of the country by 2020.
So what really does this mean for the country's health sector, and what plans does government have in place? Obviously, well, apart from taxing the citizens, what plans are in place to effectively deal with the situation? But before that, let's take a listen to Charles Otenelabe of the African Development Programme, who believes the country is in no position to cope with the many challenges this support withdrawal presents. He says the country's health authorities have failed to put in the necessary contingencies, despite being given prior notice by Danida on this planned action.
It's a reflection of failure to always look at the fine details as a country. We don't read. Because the health sector support program Danida kick-started as far back as 2012 with the government of Ghana. You would find in there that they had signaled this intention that they will exit their support
in 2016.
Yeah. More so because we have attained a middle income status. So really one expects that the PPME unit of the Ministry of Health which is the Policy Planning and Monetary Evaluation Unit, would have, noted this issue as a strategic risk or threat to our health sector financing, because indicative budgets from the health sector supports program by Danida, that over the 4-year period of their supports, they were going to invest close to $64 million in Danish kroner terms, over 440 million Danish kroner terms. So yearly amounting to an average of about $15 million, which is substantial. And more importantly, the component this support goes to was to help with the Ghana Accelerated MDG framework, and to the effect that they were supporting us towards the MDG 4 and 5, reducing child mortality, improving maternal health. And over 80% of this support goes to this sector. As far as the Danida support for Government of Ghana health sector financing is concerned, indeed, the study of their document will show that as far as the MDG 4 and 5, Danida support and funding for Ghana's plan of actions constitutes close to 13% of development partners' funds devoted to helping Ghana realize the 2015 MDG goal on Goal 4 and Goal 5.
Yeah.
And so critically, and more so when you look at the status of progress on our attainment of Goal 4 and Goal 5, yes, Goal 4 we have made progress looking at the reducing the number of under 5 mortality per 1,000 beds. We have made some progress, and it's indicative that we could meet the targets. But then on the maternal health issue, the picture or the status of the indicators is it's unlikely we are going to meet maternal health. I remember when a woman goes to child delivery and the woman doesn't come and the child doesn't come, and has implications for the family, for economic. So really, it is without saying that it will have impact even at the lowest level.
Okay.
And indeed, that was Charles Othinolabe of the African Development Program speaking there to Mama Vio Uswabwaje on the AM show. We've been trying to get in touch with the Parliamentary Select Committee on Health. Indeed, the chairman of that particular committee, Joseph Ilitche, we've been unsuccessful so far. When we have him, we'll bring a conversation on this very subject matter. But let's still stay with health. And the Kolebu Teaching Hospital has set up a fund to augment government's efforts in infrastructure development at the Teaching Hospital. Public Relations Officer of the hospital, Mustafa Salifu, tells Joy News a special board of trustees has been constituted to ensure monies generated from the fund are put to efficient use. He's been speaking also on the AM show.
It's about the patient, and then government is doing its part. Since 2012, government has invested more than $63 million in the retooling several parts of the hospital, rehabilitating facilities. But in spite of all of that, there are still challenges. And then we've realized at the hospital that there's this goodwill towards the hospital. But then sometimes people are not certain how they will come and then assess the hospital. So the board, upon assumption of office, decided that it's important for us to set up a transparent vehicle that we can the philanthropists, corporate bodies can donate into that fund, and the monies will be transparently used.
Let's dwell on that. Yes. How do we know that when we give to the fund, it would be used for its intended purpose?
Yes, we are thinking that yes, we have to bring in other people to come to help. So we are going to have a board of trustees made up of accomplished and distinguished Ghanaians, and from various fields who come and then manage the fund, so that if the hospital itself wants resources from the fund to undertake any project, then we have to apply, you have to make a proposal to the board. That will be independent of the hospital. They only give their reports to the hospital board. But we can't get up just as a department or unit and then go straight to the fund and say, I have this project, invest money in it. So we have those structures in place to make sure that people who donate can actually come, and then we account to the last CD how we've expanded those money.
So if I donate,
yes,
am I given preferential treatments? Does the hospital recognize me as an individual who's done some good deed?
Yes, there are plans for doing all of that. Already some organizations is made some donations, and they have been given the opportunity. We have named wards after them. For doing all of that. So all of these things are ways of recognizing those who put their money into the fund.
Okay.
Let's say we are talking about the children's emergency. I don't know, when you come there, sometimes you find 2 babies on a bed. Inappropriate though it is, sometimes if you ask them to go, it means you are virtually sentencing the person to death. So how do you do that? So if let's say multimedia decides to come and do the children's emergency for us, we can name it Multimedia Children's Emergency Center. And that will be a lasting legacy for multimedia or whatever company that will come to do that.
So essentially you want to expand some of the facilities that you already have.
Exactly, just for the patient.
Well, away from health, let's turn our attention to some politics now. And lawyers for Dr. Zaneto Ejima-Rawlings who today opened their defense in a lawsuit challenging her eligibility, to represent the National Democratic Congress as parliamentary nominee for the Klote-Korle constituency in the Greater Accra region. Incumbent Member of Parliament for the area, Niyama Ashite, and one Nijon Coleman, who actually also lost in that particular primary, filed a suit praying the court to prevent Dr. Rawlings from holding herself out as parliamentary candidate-elect for the constituency on the ticket of the NDC. The Electoral Commission has meanwhile disclosed that Dr. Zaneto Rawlings, the disputed parliamentary candidate of the National Democratic Congress for that particular area, is not a registered voter according to their records. Now, the disclosure is the basis for a current challenge of her eligibility as the party's parliamentary candidate. Let's get on to the phone lines now and speak to Deputy Communications Director of the ruling NDC, Fred Agbenyo, who is joining us right now. Mr. Agbenyo, good morning. Many thanks for your time.
Good morning, my brother.
So, Fred, let me first and foremost ask, what's your understanding of this statement put out by the EC in the first place?
I'm not too sure. We have not really discussed this particular issue. And I'm not a lawyer, but my layman understanding is that the law is that before one contests an election as a member of parliament, the fellow should have met some criteria, which includes also that it must be a registered voter to be able to contest. Now, following this issue, especially in the media, and the understanding I'm getting is that as an actor as of now, is not a registered voter. You know, so when we're doing our vetting for the elections to be conducted, that issue really didn't come up too seriously because we knew that there will be this limited registration that was done. And so therefore, before she goes to register the electoral commission to contest, she would have obtained a voter's ID card and be a registered voter. But I think that since the issue is still in court, I don't even have to go into the details. Their own lawyers will go and argue it out. For us as a party, we have taken a decision, we have vetted our candidates. If the court says otherwise, we'll do what is needed.
So, what does your constitution actually state? I want to try and understand something. What does your constitution say are the requirements for any person who wishes to contest on the ticket of the NDC as a member of parliament?
Well, I think our constitution is very clear that one should obtain the qualifications as per the 1992 constitution, and then also you meet the guidelines of the party, which includes that you must come from a constituency, you must be a registered member within a constituency. One should have been be a member in that constituency for a number of years. Either it was 4 years, you have reached to 2 years, and there must be a party member of good standing. Good standing means that your party card, you are paying your dues up to date. Then you are qualified to contest once you meet the constitutional requirements and this guidelines from the party.
So does that particular explanation you just gave to me, does that not suggest that the party has perpetrated an illegality and in fact is seeing it through this whole time?
You see, I don't know where the illegality comes in. The constitution says one should be a registered voter. Now, by the time, I made a point earlier that by the time one goes to file nomination letter,
okay, Fred, just hold on briefly, and I'm having a copy of your constitution. I'm trying to read something. It says a member shall not be qualified to contest primaries for any parliamentary seat if he, A, is disqualified under national electoral laws from contesting for any parliamentary seat, and your constitution is subject to the 1992 constitution, which suggests that for anyone who wishes to contest the seat of a member of parliament, he or she must be a registered voter. So I'm trying to link the two of them, which suggests to me that you need to, at the time of filing to represent your party as a member of parliament, that you must have met these criteria.
You see, again, I said I'm not a lawyer, and two, because the issue is in court, I think that we need to be very careful how we go into this issue. Now, the point I'm making is that NDC, one, the fellow must be 21 years and above. Somebody who is qualified to be a registered voter. We were very much aware at the time we were doing the vetting that limited registration will take place. And that limited registration will precede registration with the Electoral Commission. So by the time we're going for, or we'll be going for national elections, whoever is qualified, is 21 years and qualified for the Constitution, would have registered and be holding a card, which then would have made him eligible to contest the election. That went into our decision and all that. So it's not as if we are not mindful of it, but we know that there's a room of provision for that to be cured before the election.
Interesting there. Someone saying that, well, the party has bent over a little too much just to allow Rawlings to contest in this particular election. I mean, is that an assertion you agree with?
Well, you know, our party, our party is not respectful of anybody. The constitution of our party is very clear. It doesn't matter who.
No, but clearly, we are speaking of the founder of the party, and one would say one of the most influential people in the party and in the whole of Ghana.
He's the founder of the party. The daughter is contesting, very influential person. There's no two ways about it. But if you are not qualified by the constitution, nothing anybody can do. I will just give you an example that there was even a sitting member of parliament who refused to pay his nomination fees on time, on the specified time that we gave. And we disqualified him. We didn't allow him to contest the election. You know, so NDC, once the constitution is there, it doesn't matter who really is involved. We would have followed the issue strictly. So it has nothing to do with her being the founder's daughter or not. I think that we strictly went by our laws, and we think that she was qualified, and that's why we cleared her to contest.
Is the party ready for a rerun should the courts decide that indeed Dr. Zaneto Rawlings did not meet the criteria at the time of contesting for this particular primary, and as such cannot be held as the NDC's parliamentary candidate for the Klotikole constituency? Is the party ready?
When we get to that bridge, we'll cross it. Like I said, when the court takes a decision, there's nothing we can do. After all, the persons involved have satisfied themselves that the decision of the court is what is correct, and all of us must abide by it. We'll abide by it. If the constitution says that Zaneto is not qualified for the process, and so she cannot contest the election, naturally we'll open nomination and then we'll have another election. If the court clears her to continue, we'll go ahead and organize our elections come 7th November.
Fred Agbenyo, many thanks for your time on News Desk this morning. And Fred Agbenyo is the Deputy Communications Deputy Communications Director, I beg your pardon, for the ruling National Democratic Congress. He's been expressing his thoughts on that particular issue. And I must tell you that as we speak, a court is hearing this particular issue right now. We'll be bringing you a lot more once the hearing is done. We'll be getting in touch with our correspondent, Kwacha Fred Nyama, who is live in court as we speak. We'll be bringing you a lot more on that pretty shortly. But time now for us to take a break here on News Desk. We'll return shortly with some more news. Don't go away.